Welcome to the Probate Nation. My name is Richard Ruddy. Our show this evening is the first of a two-part series on Medicare decisions. This decision-making process reminds me of a story about an older couple lying in bed one night. The husband was falling asleep, but the wife was in a romantic mood. So she said to him, you used to hold my hand when we were courting. So her husband reached over, held her hand for a second, and turned over and tried to go back to sleep. A few moments later, she said, well, you used to kiss me as well. And somewhat irritated, he reached across, gave her a peck on the cheek, and settled down to go back to sleep. A few seconds later, though, she said, you used to bite my neck. Our husband tossed the covers off, got out of bed, and headed to the bathroom. His wife said, where are you going? And he replied, I got to go get my teeth. So humorous story, but with a point that this show will illustrate. Medicare selections are important financial decisions, but mistakes are often made, and these mistakes can result in a very significant financial bite out of your savings. So to help us make good decisions and keep more coin in your pocket, we are pleased to have back as our guest, Emily Lang, owner of the Medicare Coach. Let me tell you a little bit about Emily. Emily and her team at the Medicare Coach provide independent advice to seniors and their advisors on how to get the most out of Medicare coverage. She also runs a Medicare enrollment concierge program to educate folks on Medicare options, pitfalls to avoid, and tips on decisions to be made. She's a graduate of University of Kansas, and prior to her work for the Medicare Coach, she worked as a risk manager for Goldman Sachs. Emily, welcome to the Probate Nation.
Thanks for having me, Richard. It's great to be here today.
Oh, it's wonderful. Before we jump into the program, there are so many decisions to be made with Medicare. Can you share a common mistake people make when making these decisions?
Absolutely. So I think one of the things that people oftentimes do is that they go into Medicare assuming that they've done this before. They've picked out their health insurance from their employer in the past, and they assume that they can do Medicare as well. But it oftentimes leads to mistakes. I was talking to Judy a few weeks ago who actually received a $40,000 bill which caught her very much off guard from her doctors, and she had no idea why she had this massive bill. Well, what happened is that she thought she was knowing what to do with Medicare, but it was absolutely the wrong decision, which resulted in this huge cost, which is a massive impact on her overall financial and retirement savings.
Well, that's something we definitely want to make sure that we avoid those types of mistakes, but I know there are other pitfalls along the way, so let's just go ahead and jump into the program and kind of work through the process that I think you find to be most helpful for folks in making these types of decisions. So first of all, let's begin with what is Medicare and why is it so confusing?
Sure. So Medicare was created, a while ago, 1965, to help people actually get health insurance as they get older. So there's two main key parts of Medicare, which is Medicare Part A, that's mainly your hospital insurance, and there's Medicare Part B, which is your medical insurance. Most of us usually use Medicare Part B. Now, Medicare Part A is, I'm going to call it free, if you have worked your 40 quarters, which is 10 years, and you've paid into your FICA taxes, but Medicare Part B is not free. For 2023, most people will pay $164.90 a month for Medicare Part B. So those are kind of the high-level overview of what Medicare is. And I think it's confusing because one, we have all of the government rules, but two, we also have insurance companies trying to sell their plans. And so you get a lot of different messaging or lack thereof from the government, which results in a lot of confusion, people kind of trying to figure out how to make sense of the whole thing.
Sure. Now, if I'm a high-income person, will that have an impact on the cost of Medicare to me?
Yeah, it will. And I know it sounds odd. So it won't impact your Medicare Part A. As I mentioned, that's really based on your FICA taxes, but it will impact both your Medicare Part B as in boy, as well as Medicare Part D as in drugs. And the odd thing is that Medicare will look back at your income from 2 years ago to determine what you pay for Medicare today.
Okay, so let's talk. The Medicare Coach has a 5-step process that you use to help your clients make good Medicare decisions. Tell me why this is important.
I discovered after working with Larry, who founded the Medicare Coach, that So many people were making the wrong decision because they didn't really know where to start, right? The insurance companies were showing them one thing, the government showed them this massive book, and we found that through a 5-step process, everyone can avoid those big mistakes they tend to later on regret.
Okay. Well, let's go ahead and I know there was a story you had about a gentleman named Bill who apparently called you and he was in tears about something happened with him. Tell us a little bit about that.
Yeah, so we got a call from Bill. It's been a couple months ago now, but Bill called us looking for help because he was confused and overwhelmed and disappointed. But Bill called basically on the brink of tears because he saw a Medicare advertisement and it sounded really great. A celebrity endorsed it. He had then talked to an insurance agent who then recommended the plan, and he was told it would save him quite a bit of money. But the thing is, once he started using his Medicare plan, it was very, very expensive, and his wife could not see their preferred doctors for her cancer treatment. And so again, with our 5-step process, if he would have followed it, this would never have been an issue at all.
Okay. Well, let's go ahead and get started with the first step. So your first step to help make the right decision starts with knowing when Medicare starts. So can you walk us through that analysis?
Yeah, and I know it sounds odd because most people think that you join Medicare at 65, but that's not always the case. Medicare rules say by the time you're 65, you either need to be on Medicare or on an employer health insurance plan which meets Medicare rules. So more people are working past 65 these days, right?
Sure.
And for that reason, if your employer health insurance meets Medicare rules, you can absolutely delay Medicare past 65. But what I oftentimes see happen, Richard, is that either one, people are on an employer plan and Medicare because they're scared, they're nervous, they just do it all to be covered, and that's a big mistake for later on. Or number two, they assume that their current health insurance meets Medicare rules and it doesn't. Whether it be COBRA or whether it be a market share plan or whether it be a Medishare plan or even a small employer plan. Just because you have health insurance now does not mean that it meets Medicare rules.
So apparently, can we delay enrollment then into Medicare past 65 without penalty?
You can if you have employer health insurance, which meets Medicare rules.
Now, do I need to be on Social Security to join Medicare?
You don't, and most people will start Medicare and Social Security at different points of time because they are different decisions.
And so, if I'm drawing Social Security, does that have any impact on Medicare?
It can. So if you are drawing Social Security 4 months before your 65th birthday, you will be automatically enrolled in both Medicare Part A as well as Medicare Part B.
Okay. All right, let's go ahead and take a look at step one. Okay. Tell us about the Medicare programs that are available.
Yeah, so that's the first step is really understanding, or the second step is about understanding which Medicare program fits you best. And there are two main paths to Medicare. The first one is called traditional Medicare, also called original Medicare. And the second path is called Medicare Advantage, also called Medicare Part C, as in Charlie. So no matter which path you go down, you have to have that Medicare Part A and B that I just talked about.
So tell me I'm sorry, go ahead. Pardon me.
No, but just because Medicare Part A and B doesn't cover everything, you get other parts of Medicare as well.
So tell us a little bit about traditional Medicare Part A and B and how it works.
Sure. So with traditional Medicare A and B, you can go to any doctor across the entire country who accepts original Medicare. And it is administered by the federal government. They are the ones negotiating prices with your doctors and your hospital. So traditional Medicare works really well for those of you who want to see doctors across the country, or maybe travel quite a bit to see family or friends, or even just for holidays. But you have more flexibility with doctors usually with traditional Medicare.
Now, let's go down the other path. Tell us a little bit about Medicare Advantage Part C and how that works.
Yeah, so Medicare Part C, also called Medicare Advantage, tends to work like HMOs or PPOs. So they tend to have a limited networks of who you can or cannot see. It also is a little bit tricky on Medicare Advantage because they tend to have co-pays for different services, and they also have maximum out-of-pockets, which can be really high for many people once you do have health issues.
So what are some of the common misunderstandings and pitfalls of traditional Medicare?
I think the biggest thing that people assume that Medicare is free, right? They've been paying into Medicare, and they assume that they're going to pay nothing. So they're surprised by that, but they also assume that Medicare Part A and B is enough. But Medicare Part B only covers 80% of your expenses. So that's all that you do. You're going to have some really big expenses once you do start to have medical costs.
So what does traditional Medicare not cover that a Medicare Advantage plan often does cover, and why is that important?
Yeah, I'd say Medicare Part A and B don't cover any of your prescription medications that you pick up from a pharmacy. While most Medicare Advantage plans do bundle that together in their Advantage plan. So you need to get extra Part D coverage if you're on traditional Medicare to, one, avoid penalties, and to, two, also have prescription drug coverage.
Now, are Medicare Advantage plans less costly than traditional Medicare plus Part D plus a Medigap plan?
Yeah, good question. So Medicare Advantage tends to have lower premiums. But when people start to have health issues, let me rephrase it. People have lower premiums on Medicare Advantage. But when people start to have health issues or health expenses, Medicare Advantage tends to be a lot more expensive than traditional Medicare with a Part D and Medigap plan.
So how does the cost of traditional Medicare compare to the cost of a Medicare Advantage plan?
Yeah, so either way, whichever path you go down, you're still going to have your costs for Medicare Part A, which is likely nothing, but Medicare Part B. You'll then have other premiums or other copays or out-of-pockets. When our clients are on original Medicare, I tend to recommend that they budget around $3,000 per year plus your medication copays. While on Medicare Advantage, I usually recommend you budget between $4,000 and $10,000, which tends to be the maximum out-of-pocket on those plans, plus any medication copays as well.
So what are some of the common misunderstandings and pitfalls of the Medicare Advantage plans?
People also think that it's free. People are quite surprised because of all the ads that they're, free Advantage plan, but you still have to pay for Medicare Part B. So that's a big thing. Also, Advantage plans tend to refuse to make certain payments more so than original Medicare. So we see people get their physical therapy denied, or maybe even hospital stay denied. It can be a little bit more tricky to get certain services paid for through Medicare Advantage.
So, and what are some of the key factors to consider if I'm evaluating original Medicare as compared to Medicare Advantage?
Yeah, I always ask my clients, what's your goal? Most people's goal is to be able to see their preferred doctors or be able to travel across the country if they were to have a serious health issue, or overall cost. They want to keep the overall cost as low as possible. But if you're someone, Richard, who says, my most important decision of Medicare, of healthcare, is a free gym membership, then that will take you on a different path. So getting really clear on what your goal is it doctors, is it cost, is it those free perks, and that will help guide you down one way or the other.
Okay, let's go to our next step. Tell us a little bit about what is Medicare Part D and what are our choices?
Sure. Medicare Part D covers your prescription medication. So because Medicare Part B, or A really, cover no prescriptions that you get from a pharmacy, there are these separate plans called Medicare Part D drug plans. And they are offered by private insurance companies. There's usually between 10 and 30 for every single zip code and county to pick from, but there are these private prescription drug plans to cover you for those expenses.
Now, how do you find the right Part D coverage?
Yeah, it's based on your medications, your pharmacy, as well as where you live. But at the end of the day, our goal with Part D drug plans is to get the plan that covers your medications and your pharmacy at the lowest cost, because there can be huge cost differences for the exact same medications as well as pharmacy across the different plans.
Now, can you change your prescription drug plan periodically?
You can. So most people will change their Medicare Part D drug plan during Medicare's annual enrollment period, which lasts from October 15th through December 7th. So everyone can change that plan no matter what your health conditions are.
All right, so we were talking about in traditional Medicare, we have a couple of different pieces that we have to kind of fill the gaps on. tell me can you explain what's the purpose behind a Medigap plan?
Sure, Medigap plans are there to protect us financially. So while Medicare Part A has more or less its own deductibles and out-of-pocket expenses, Medicare Part B usually only covers 80% of approved medical expenses. So without a Medigap plan, you are paying 20% of your medical costs, which can get really expensive. So Medigap plans protect us financially from having to spend a ton of money on your healthcare expenses.
So we want to make sure we have a Medigap plan. So is that a plan that's offered by the feds, or is it offered through a private insurance company?
They're offered by private insurance companies as well.
Okay, those are all those ads that we're starting to see, that you see come out in October and November as the enrollment period opens up. Can you offer us any insights, though, as to how to evaluate and select a Medigap plan provider?
Sure. So how we recommend that we pick out companies to pick that plan through, it's based on a few factors, such as the financial stability of this company, right? Are they a poorly financed company that might go bankrupt tomorrow? Or are they a strong, stable financial company? We want to look at the history of the rate hikes, right? Have they had a history of keeping rates low, or can they not really manage their expenses and have had huge rate hikes at certain points in time? And also, what's their customer service like? Are they good customer service? Are they going to answer your phone call if you have issues? Or are they going to kind of send you to someone overseas that can't really help you either? But those are the main things that we look at to pick out that best company.
So generally, I guess, once you're enrolled in Medicare, then you have to make your selection for this during the enrollment period, open enrollment period. So what if I missed a deadline? When's the next time that these plans can be selected?
Yeah, so as you mentioned, in most cases, you are guaranteed to get a Medigap plan within your 6 month of beginning Medicare Part B as in boy. So if you miss that 6 month window in most states, you are not guaranteed to get another supplement plan without having to undergo medical underwriting or provide your medical history, and they're not required to accept you. So in most cases, if you miss that first 6 month window, unless you're leaving an employer plan, you're not guaranteed to get one of these other plans in the future.
Now, if I'm in a Medigap plan, can I switch it? And if so, when can I do that?
Yeah, it depends on the state, but in most states, you are not guaranteed to change supplement plans or companies or any of those details unless you undergo what they call medical underwriting, where they ask you for your health history, and if they see no red flags, they'll accept you then. But it's not guaranteed to be able to change these plans once you're already on Medicare.
Okay. Well, we're already in step 5, so how do I apply for Medicare?
Yeah, so applying for Medicare, Medicare A and B, is done through the Social Security office, which I know sounds odd, because you think Social Security is just Social Security, but you apply for Medicare Part A and B through Social Security, and you also apply for your Medigap, your Part D, or your Advantage plan through private insurance companies. So there's 2 different paths for the different types of plans.
Okay. Well, we're at a point where we actually want to draw upon your experience and kind of talk about, some of the final thoughts you have and words of advice about Medicare decision-making plan based on the information we've drawn out during this 5-step process we went through. So you can share some thoughts with us?
I would just say, please get your Medicare decision right when you first join Medicare. People have worked so hard for these benefits, and Medicare can be fantastic when you ultimately do what's right and best for you. But again, please be careful of the advertisements or of people's recommendations who are not Medicare experts, because it can lead you down a very bad path. It's hard to undo. So please be careful. Medicare can be fantastic when you ultimately do what's right and best for you.
Yeah, I want to come back about undoing, because I think we had talked about this. If I am in a Medicare Advantage plan, how easy is it for me to come back into traditional Medicare?
Yeah, good question. So again, it goes back to that 6-month insurability window. So there's certain rules, but in most cases, Richard, if you were to first join Medicare Advantage and you want to go back into original Medicare, while that is possible, you're not guaranteed to get a Medigap plan. And what does that mean? So Richard, again, you could leave your Advantage plan, go back to original Medicare, But if you can't get that Medigap plan, you're going to pay for 20% of those medical expenses.
Ouch.
And exactly. And what we tend to see what happens is that people pick a Medicare Advantage plan when they first join Medicare because they tend to be healthy. And that's fine. Anything works when you're healthy. But once they have health issues, they tend to want to go back to original Medicare with that Medigap plan.
Okay.
But at that point in time, because of Medicare rules, it's usually too late to go back. And so they're kind of stuck in Medicare Advantage and they can't go where they really want to go because they can't afford it.
Oh, that's really very challenging. Now, the other thing I want to bring out too is with the prescription drug plan, you recommend that people go back and review that every year. I know we talked about this. Sometimes if you're in a retirement community, you may have some special advantages because of relationships they have with certain prescription providers that might also add to the savings for you. Can you talk a little bit about what you've seen in that area?
Absolutely. So again, Part D plans you can change every year, no matter what your health conditions are. And we do see that really everyone benefits by changing Part D, or at least reviewing Part D drug plans every year. But specifically if you're in a nursing or a skilled nursing facility. And the reason is that many of those facilities have contracts with certain pharmacies. So maybe a CVS is going to deliver to your facility every single day. But if that contract changed and maybe now it's Walgreens or whoever else it is, those costs, those plans will be significant between the two different pharmacies. So if you or a loved one are in a facility, ask them for the new year, are you going to change which pharmacy is delivering your prescriptions?
Oh, wow.
And if so, find that best plan. Chris, who works for us, her mother was in a facility and she saved $5,000 in just 1 year by reviewing her Part D plan for this exact reason. They were changing the pharmacy that they were having deliver medications. And so we had to change the Part D drug plans with them.
Oh my goodness, that is unbelievable. That's very scary. And I think that's probably why we have cautioned at the outset of this show, it's important to really take your time and understand what you need to do and just don't automatically renew. I think that's one of your big points. Well, Emily, I want to thank you for taking the time to help all of us begin the process of understanding, better how Medicare option works. It's great information, wonderful public service to the viewers of the Probate Nation. I just want to thank you for taking the time to get us started on this discussion.
It's my privilege. Thanks for having me, Richard.
You're very welcome. Emily from the Medicare Coach has really given you an excellent introduction to Medicare options. No one plan is right for everyone, that is clear, and there is much to consider before you make these decisions. The key concern I draw from this program is that some Medicare decisions cannot be changed, and that can prove costly. So there's more to learn. So before you make any decisions, I encourage you to tune in next week for Part 2 on Medicare, Medigap, and Medicare Advantage decisions. This concludes our show this evening. Just a reminder that replays of this show can be viewed on the Probate Nation website and YouTube channel. And if you want to receive monthly estate administration and probate tips, please sign up for the free Probate Nation newsletter. Thank you for visiting with us. Until next time, I am Richard Ruddy, and this is the Probate Nation.